Hello everyone, once again I want to welcome you here with us in the sitting room. We have two big shots here. I think it will be necessary. I wouldn't want to do the introduction. I will want them by themselves to tell us who they are, why they are here, and what they think about the whole thing. Thank you. Sir, good evening, sir.
Yes, good evening.
May we know you, sir?
Thank you very much. Well, my name is Dr. Okeji Austin. I'm a public health physician, and I work with the State Ministry of Health, Imo State, as the Director of Public Health. And we have, I came here in company with my colleague, another director also in the State Ministry of Health. His name is Dr. John Daniel. He's the Director of Medical Services. Yeah, we are here in respect of the free medical campaign outreach that is being organized by the Onolese group, which we've been informed has held yearly in the past 3 years, and the State Ministry of Health via the State Commissioner for Health is actually approached to come to actually flag off this activity, which I understand is a two-day activity. Fine. So we are here and we are happy really to be here on the directive of the Honorable Commissioner. One is that this is something that is quite impactful positively on the health of our people, and we know that the world agenda now is universal health coverage. And we understand that by public-private partnership, this is possible to be achieved. And we know that because of the kind of issues of health financing that is real in our environment, particularly where you talk about out-of-pocket expenditure, that seeking health care by that method mostly impoverishes people, even the more. And for which reason we think that in as much as this is a once in a while approach to health care service delivery, but it's also quite impactful. But we think that moving forward, that there has to be an agenda in sustainability. But all in all, it is to appreciate the efforts of the organizers and express the willingness and of the government of Imo State via the Ministry of Health to continue to collaborate with them in our efforts to ensure good health, standard and qualitative health care for our people. Thank you.
Thank you so much, sir. So, this is the 4th edition of this program, the 3rd edition of this program. Honestly, the people I've seen today, I've never seen them before, to be honest with you. I know before now, we experienced the presence of the honorable member representing Itu-Boma State Constituency. We also, having a miss here before now, the chairperson of this very local government area. Sir, how do you see this program? Do you think this man he's tried so much? Do you think he should stop, or do you think he should continue from, or get to the next level of this program?
Yeah, that's what I have already said. I've already said that it's a very, very novel idea, and it's quite a good effort to be really encouraged. It's quite welcome. I've said that we see this as helping government to even fulfill part of its mandate. And I've given you the background of healthcare financing in this environment and what the world order is all about now. And we are rather more concerned about sustainability. Right now the state has what we call the State Social Health Insurance Program, and which we also think that because what they are doing takes them a whole lot of resources, financial resources, and for the purpose of sustainability, one also thinks that this can find some avenues, okay, into some form of collaboration with the health insurance program of the state by way of ensuring premium for a good number of people that are being seen now. In fact, sometimes it may become even more cost efficient and much more effective in providing the care, because the one-off approach, at that point that is carried out, is able to do some good impact. But moving forward, you discover that the people need to be followed up, and so that's what we do.
Yeah, sir, please, I will come to you to chip in some things. What is your advice to the donor or to the host concerning this program?
My advice to him is, before I give an advice, I think I'd like to continue from where my colleague have just stopped. I will first commend him and the wife and other members of the foundation for their laudable objective. I'm equally aware that this is the third round of this medical outreach, and over 1,000 patients have been seen. We are opportune to see a few of them leaving the premises, and they all left happily. And some even said the program will continue tomorrow, and that they'll be here quite early. My advice to them is, may the good Lord that started this program continue to encourage them. It is a laudable thing that they should be encouraged. We've not seen this thing for the past, especially where out-of-pocket expenditure in Imo State is 92%. And now an individual or an organization is coming to assist us. So my advice is they should keep it up. It's a good job. One day we'll all have cause to smile and rejoice. Thank you.
Thank you very much.
You're welcome, sir.